Good afternoon, this is PairFect. I am Dina Ventura.
And I'm Francine Marquez. And today we have a special guest. She's a specialist, a medical practitioner, specializing in the field of public health. Let's all welcome Dr. Anabelle Fajardo.
Hello, Doc Anabelle. Welcome to PairFect.
Oh, thank you
Hello.
for taking the time.
Hello to both of you.
Opo.
Thank you for having me here.
Dr. Anabelle, where are you right now? Parang maganda yung gray na nasa likod mo.
Oh, you look so comfortable.
You look so comfortable.
Frankly, I'm inside my room and on my bed.
Ah,
Wow,
nice.
talaga,
Oo.
pandemic has changed the way we live.
Yun na nga. Parang medyo bagay yan sa pag-uusapan natin
Oo nga.
mamaya.
Ay, yes, tama. So, Doc, let's get on with the interview. Let's start by asking you first, how have you been during this pandemic?
Okay.
Kumusta ho kayo ngayong pandemic?
Mabuti naman. I've had the whole of my family completely vaccinated by this time. And we continue to practice the protocol, mask always, and wag muna magpupunta sa mga matataong lugar and everything. Although talagang yung mga close families and friends ay nagkaroon at namatay din because of COVID, and it's a very sad thing that happened. But we cannot really do anything about it. Just it's the Lord's way siguro. But kung kaya natin to keep out of danger and keep ourselves healthy and happy, why not, diba?
Yes. Di ba? Parang, that's really a struggle now for people to be
Yeah.
aware of.
To be safe. It's a struggle
to
to be
stay
safe.
safe and then keep themselves, talagang balanced lang.
Oo, steady.
Steady
Eddie.
Steady Eddie.
Doctora, tell us about the work that you do that's covered by public health. Ano ba exactly ho yung sakop ng public health?
Public health is really about epidemiology, which is the most relevant thing dahil because of the COVID pandemic. Talagang epidemiology is study of how diseases come about and what we as individuals and the health system should be doing to address and the pandemic, and exactly what we should not and be doing and what we should be doing more of. In a nutshell. But it also public health also covers a lot of programs. I think we have forgotten a lot of programs kasi akala natin epidemic siya o pandemic siya. Pero andyan din yung syempre my favorite program of all, family planning,
Yeah.
sa mga bata, children, maternal and child health, sa mga buntis, yung adult health, at saka marami pa yan. It's really about something about from womb to tomb ng mga nangyayari na processes both sa men and women. Basically, reproductive health also.
Okay. So, wow. Okay. Family planning. Speaking of that, Doktora,
Yes.
it's been
Tama dyan ang
reported.
sex, ha?
Yes, it's
Sex
been
and no sex.
sex and no sex. So it's been
Very
reported,
interesting
Doc,
topic.
na
Always a very
maraming
interesting
naging nabuntis over the pandemic because of the quarantines. Should we worry about this? Is this
Yes.
something that should concern yung public health?
Oo, dumadami ba mga pandemic babies natin?
I know. So paano yan? Anong effect nun sa ating population and everything?
Kayo ba, meron na kayong
Marami mo kaming mga anak.
population. Marami kayong mga anak.
Mga
At
anak-anak.
Marami gusto pang magkaanak.
At marami kaming mga anak-anakan.
Oh, yan.
Okay. Population is always parang may two-pronged thing yan lagi. Should we go for a big population? Should we increase or should we decrease? But it's really about managing it. Sometimes kahit na meron gusto ang mga public health officials at the DOH na through the family planning program to really control the population or manage it. Hindi talaga mo makokontrol eh. Kasi sa national level o kahit international level, sige, pwede mo siyang sabihin na aralin mo. Ano ba nangyayari? Ba't tumadami ang bata? Ba't tumadami nanganganak? Bakit walang birth spacing? Parang sunod-sunod, parang hindi pa nakakadapa yung bata. Yung bata, dumapa na yung tatay, kaya buntis na agad si misis. Parang tipo na nun, sunod-sunod. Tapos, di ba? Tapos naisip mo pa, why those who have less resources tend to have more children than those people who have more resources, di ba? Parang laging may pros and cons about it. But the thing is, ang population ay parang born out of natural element din. Pero individually, it's really about the choice of the couple and basically the choice of the woman. Kung will I go for another baby at this time, another child? Kasi may ways naman na huwag ka muna mag-anak to postpone pregnancy. Para kung halimbawa, in your given lifetime, pwede ka manganak ng 10. And pwede naman 2 lang, di ba? And you risk dying by giving so much, by giving birth more often than you should be able to. Parang ganun. So, choice pa rin ng babae, choice ng couple, and the government, and the program itself is only there to help na masabi mo na pwede naman mag-birth spacing. Huwag naman bira ng bira, sunod-sunod, parang gano'n. So may family planning methods na fit at perfect for each and individual.
Okay. Importante yan yung family planning. Kasi right now, in our world today, di ba, women take on more responsibilities. They sometimes are the breadwinners of the family. So talagang kailangan, spacing is important. So you can also take care of your children even when you're working.
Yes. Kasi it's really about women empowerment. Alam mo, tanga na lang talaga si nanay na hindi pa alam kung anong dapat at karapatan niya. Kasi a family can really go a long way and improve generation for generation. Kung ang nanay talaga, the woman itself is empowered by her choices. Yun lang talagang education and lahat siya, dikit-dikit na talaga yung mga determinants of health na yan. Na talagang factor para para sa isang pamilya at sa kinabukasan ng isang bata. Yan. Pero pag isipin mo, sabi ko ang population is a very mysterious cycle. Sa dami lang namamatay dahil sa pandemya, parang okay lang, nature will correct itself by letting women or giving birth to babies. Kasi alam naman, ubusin natin yung generation, walang pampalit. Parang tipin ba lang. So, yun yung irony of things na nature niya na nagpupol. Habang may marami na mamatay, marami rin nabubuhay na bagong silang na bata. Yun lang, palit-palit lang yung cycle of life. So, nothing to worry much. Ewan ko, baka nature is really tricking us into its natural cycle. Parang gano'n ang tingin ko sa pandemya na to.
Oo nga, life finds
ba
a way.
ako maraming nabubuntis? Sige lang, mabuntis sila. Basta so long as meron silang responsibility na mag-carry nilang bigyan ng magandang kinabukasan ng bata to the best of their ability, so help them God.
Si Doc talaga.
Parang gano'n.
Doc.
Kasi
Sige, go. Kasi the pandemic continues to pose challenges para sa mga tao nangangailangan ng medical care di ba? Dahil daw sa COVID-19 cases po kasi yung
priority.
Does it seem na COVID-19 cases yung nagiging priority? Anong tingin niyo sa situation na ganito? Yung ganitong point of view or opinion ng karamihan?
At the moment, talaga At the moment talaga, we have no choice but to really go for the emergent cases. Ang nagkataon kasi, emergency talaga ang mga COVID cases, lalo na yung kailangan ma-ICU and everything. Kaya nga, it's putting a big chunk of the pressure and it's really challenging our health system in itself. Dami ng nangangailangan ng medical services and care dahil sa pandemya. But ang call ko lang, ang take ko lang sa situation is because nakaka-shift itong ating priority towards the COVID cases, talagang nakakalungkot na maraming mga programs at maraming mga other aspect ng public health at ng pagtigil ng medical services ang nalilimutan na. I mean, hindi siya nalilimutan but hindi siya prioritize in terms of resources. Like for example, ano na ba ang nangyayari nga particular sa family planning? Kasi pwede mo siyang i-neglect, manineglect yung mga programs na yan. TB, ang tuberculosis program, which can also kill.
Yeah.
Pero silent killers yan, di ba? Hindi naman natin nararamdaman kasi hindi naman yan araw-araw na napopost. Ilan na ba namatay sa TB as against sa COVID? O ilan na ba ang namatay sa unwanted pregnancy? Yung mga na-abort ng hindi dapat na pa-abort. Dahil alam mo na and everything. So, ilan na ba ang namatay sa mga accidents? Ilan na ba ang namatay sa ibang cases? So, because we have been really burdening the health system, talagang nare-neglect yung ibang health programs at ibang aspect ng medical care. Yun lang ang both sad, nakakasad at saka nakakatakot din in the long run. Kasi we are not able to address that. We are not able to put the right resources for these other aspects of the medical care. Ay, naku, malit man yung pandemya, ang dami natin problema kaharapin na. TB children and everything. Diba? Sad lang, sad.
Yeah.
So I hope this is a call then sa mga authorities as kaya yung mga controversies na surrounding Blue Asian ay talagang nakakasad. Ilang masasabi ko bilang isang doktor, parang hindi natin kailangan ng mga controversies na yan sa panahon ngayon na kailangan natin ng direct healthcare.
Yes.
Yeah.
Naku, marami pa kami.
Oo. So, Doc, pag-usapan natin yung parang how you ended up being a doctor. Talk about your passion as a doctor, di ba? Pero we'll talk about that after a short break. We'll be right back. And we are back on PairFect with Dr. Anabelle Fajardo. So, Francine, magpakwento naman tayo.
Oo nga eh.
Paano
so
siya
much
naging-
passion kasi to sa trabaho si Doktor eh.
Oo, Doc. So, what inspired you to become a doctor?
Oo.
I don't know, but ever since I've been a child elementary days, high school days, pag sinusulat sa essay what they want to be, just ko, bakit ko pa sinabi lagi, I want to be a doctor. And that ends it and began everything. And I mean, siguro I've never, pero walang doctor sa family namin. Ako parang ang doctor sa family.
Okay,
So, first
wow.
generation doctor ako.
Yes, and your children also.
Na my children, all of my 3 children are now studying to be doctors. 2 na doon ang nurses.
Okay. Kailangan kayo namin
Grabe.
at this time.
Oo. Passion, tama ka, when it comes to being a doctor, it will really start to be a dream. And then when you work towards a dream, when naging doctor ka na, pwede mo na yung tug sa sarili mo, ba't mo pinasok to? Kasi it's really so hard to be a doctor.
So,
Then
Doktor,
after that, nasasanay ka na sa hirap ng pagiging doktor, it becomes now a passion. Kasi pag naubos na yung passion mo, pasensya mo, and passion, it goes hand in hand. Balik ka ulit sa pagiging romantic side ng pagiging doctor.
Ideal-
It's really about
ideal
yung bottom line is really about ideals eh. You really want to serve the Filipino people so healthy values. Parang
what do you tell your...
and sa career ko talaga, I've had the pleasure of really serving the people of Venezuela through the initiative of the then city mayor, now Senator Sherwin Gatchalian. Is really a very passionate person na nakalala ko na isa sa mga passion, at saka yung mga kapatid niya,
The Gatchalians.
Mayor Rex Gatchalian. So, grabe talaga yan. Don't work under them kasi talagang titigain nila ang passion for the people. Grabe talaga sila.
Yeah.
Siguro naman kung may mga taong nagkita-kita lang na passionate about everything else, may inspire ka talaga maging doktor. Kasi, kaya ako na-inspired din sa public health dahil dyan. So, I really studied for it. And luckily, I was also able to teach the graduate school of public health in UERM na.
Okay. So, nagtiteach din pala
Maraming
si Doc.
maraming passionate people na doktor. Ang doktor na hindi passionate ay doktor na napapagod lang. Pero pag nagising yan, passionate ulit yan.
Okay.
Oo.
So let's talk about your the work that you do ngayong pandemic, 'di ba? So as a doctor, ano kaya masasabi ninyo, how is ano yung tong vitamin D question na to?
Oh, kasi about the pandemic,
Kasi
people are saying
when I was
na,
doing all my Yes. Kaya when I was doing all about my consultancy sa DOH, located sa mga regions, at ating pa ako ng Marawi for to train the midwives and doctors din on family planning. So talagang balik sa IPERN kasi accidental lang talaga ako sali ko sa IPERN. Na-attract lang talaga ako sa medicines as a doctor. So yung PERN D, which is vitamin D, back then, kilala masyado sa vitamin D, sa PERN D. Wala pa nga yan sa Philippine Formulary, sa MIMS, wala pa siya. But now, nandyan na siya sa MIMS. So, FDA approved na siya and everything.
Okay.
So, na-attract ko siya kasi it has the power really to give help sa paraan na hindi mo alam. Kasi di ba, ang Philippines naman, very sunny. Lagi mo may araw eh. So, why do you need to take supplements pa, di ba?
Of
Lalo na
vitamin D. Oo.
But the thing is, we tend to stay away from the sun. Kasi nga gusto natin, pumuti. Right? So, pag lagi kayo nasa office, wala namang pumapasok na sunlight talaga sa mga windows, sa cars, wala din. Kasi
Wala.
nabablock siya, yung UVB na kailangan natin talaga. So, pag nakita nyo, maraming causes ng cancer, mga autoimmune diseases, tapos yung mga like diabetes, psoriasis, and everything. So, I really research kung anong factors at anong nagagawa ng vitamin D sa health ng tao. And lo and behold, I was really so shocked na oo pala. Kasi ito yung supplements, parang passing lang yung tinuturo sa mga doktor kaya hindi talaga nila alam. Ako hindi ko rin alam. So it's just another way of knowing what the goodness of
Vitamin
is.
D.
And I happen vitamin D, D for So I happen to come across IPERN, which really offers one of the best vitamin D supplements. Kasi yung quality niya and everything, but I'm not really here to talk about IPERN. Ma-attract kayo sa IPERN ay another matter yan. But tignan ninyo yung products ng IPERN. And in particular, I'm really so proud of the PERN D. Ayan siya, PERN D. So I'm really so proud of it kasi nakita ko, napakaganda ng effect niya. And pag tinignan mo sa researches, dati na pala na nire-recommend international and everything na mag-supplement talaga ng vitamin D. Kasi associated siya sa mga upper respiratory tract infection among children and adults. Sobra na yan, dekada ng mga researches niya. At nakaka-prevent siya ng mga breast cancer, colon cancer, liver
Oh, I
cancer.
see. Wow.
Marami pang cancers, prostate cancer. So, sobra. And pag nagkaroon ka na at this point, pag nag-supplement ka ng vitamin D, ay talagang nakakatulong din para at least yung quality of life. Stage 4 cancer and everything. So, akala lang kasi natin vitamin D is all about the bones and the skin. But really, sabihin mo, tignan mo, napakadami niyan. Hindi ako na mahihiya na to really talk about vitamin D and D because tinignan mo sa researches, international at pati local, ay grabe siya. And more importantly, sobrang relevant niya sa COVID kasi even yung bago pa lang magpa-COVID, and during the pandemic, 1 year na, more than 1 year na ngayon, ang dami nang lumabas ng research sa Europe, sa Amerika, na ang lahat, makakagulat. Kahit dito sa Philippines, meron din tayong research na kung mababa, you have a low vitamin D in your serum sa inyong blood, sa system mo, you are 10 times more likely really to die of COVID-19.
Oh,
COVID.
COVID-19.
Yes.
Tapos, COVID. So, hindi ko sinasabi na if you're taking vitamin D or even Fernie for that matter, hindi ka tatamaan ng COVID. Pag tinamaan ka, at least may protection ka. Kasi, mas marami ang namamatay. Mas marami ang na-ICU. Mas marami ang bad ang prognosis ng COVID amongst those people who have a very low vitamin D inside their body.
Wow.
And that has been proven by many researchers done sa Spain, amongst sa mga COVID patients sa Spain, sa Europe, sa England, sa America, even sa Southeast Asia, even sa atin dito, it has been done sa Davao. So,
Convinced.
naman ako bilang doktor, and convinced na ako, grabe.
Oo nga ho,
Maintindihan ko siya, di ba? So, kaya, patuloy namin sila. Hindi dahil gusto namin dumami ang members ng iPern. Which is talagang gusto ko dumami ang members ng iPern. But more than that, the business side of it, my God, kung ito lang, ganitong kasimple lang na supplement ay makakatulong. So, why not give it a try? Diba, sa akin lang.
Oo naman, nothing will hurt. So long as it's for
Nothing to
for
much
health,
today.
diba? Health is investment.
for health, lalo na po ngayon na kung ang iisipin mo ay lagi ka na lang ba magpupulong at magtatago. Hindi. You can fight your way. Mag-supplement ka talaga.
Okay, that's good advice,
Straight
no?
from the doctor,
Yeah, Doc, we'll ask for more your other advice.
Hindi lang ako yung doktor na naniniwala dito, ha?
Oo naman ho.
So, ano pa? Siyempre, nandito na rin lang ako, no? Kanina, you were asking me about
Fernie.
the lack of sex ba? During pandemic time.
Ay, naku, teka muna.
Teka lang.
Bago maging hot
Bago
topic
tayo
yan.
punta dyan sa topic na yan.
Mag-break muna tayo,
Break muna
Doc,
tayo.
for a word from our sponsor, and then we'll ask you the
Sige,
hot
parang panoorin
questions.
nila.
Oo, abangan.
Magpabakuna kayo.
This public service advisory is brought to you by Daily Tribune and 100.3 RJFM. Magandang araw mga katribo! Narito na ang mga makakasama nyo tuwing umaga sa programang Gising Na. Roy Pelovelo, Comfy Manalo, Chinky Mangkukang, Vernon Velasco, Kim Sancha at Chirk Balagtas. Abangan ang programang Gising Na mula alas 8 hanggang alas 9 ng umaga sa Facebook page ng Daily Tribune.
Ilabas ng mainit na kape at samahan kami sa inyong pag-almusal, mga katribo.
Sama-sama natin alamin ang mga natatagong istorya sa mga latest na kaganapan sa loob at labas ng bansa.
Simulan ang bawat umaga with good vibes sa mga informative and recreational segments dito sa ating programa.
Maaari niyo rin ibahagi sa amin ang inyong opinion via Daily Tribune Facebook page at Tribune Now sa YouTube.
Makichika na rin sa latest showbiz happenings, mga katribo.
Kaya naman, magkita-kita po tayo mula Lunes hanggang Biyernes, alas 8 hanggang alas 9 ng umaga at magsama-sama po tayo sa
Gising Na!
Magpabakuna kayo.
Hello, I'm Francine Marquez. I'm with Miss Dina Ventura, and we're back. This is PairFect. We were talking to Dr. Anabelle Fajardo, who's a medical practitioner specializing in public health and also family planning management. Doctora, welcome back.
Yes.
Hello.
Thank you.
Oh, before we had our break, we were going to ask you something relevant for everyone, di ba?
Kasi di ba family planning?
Oh, ang daming tao.
Relevant on my bed.
Eh,
And you're on your bed.
kaya nga ho So, ang daming tao ngayon. Why is it
Relevant on my bed.
why is it that despite all this available maybe methods, no? Methods for family planning. Meron pa rin nabubuntis. I mean, nabubuntis pa rin ng babae.
Na unplanned or unwanted.
Oo, bakit? How do we, ano ba kaya? What's the context behind that po?
Actually, there's the thing called perfect use and not so perfect use. That's the pills. Ang perfect use niya talaga, iniinom mo siya araw-araw, same time. Siya. And not so perfect use is you miss pills. Nakalimutan mo for the day, ay my God, nakabulin mo for tonight. Parang tipo gano'n. Until nakalimutan mo na nakalimutan. So yun yun. So sa injectable naman, perfect use. Every 3 months, nagpupunta ka. Ang not so perfect use, nakalimutan mo ulit. So it's really about yung willpower ng babae. Kasi the health workers and mga frontliners can also do so to provide you with the services kung nandun ka, present ka. So extra effort pa sa kanila na hanapin ka and everything. Kasi dami nila masyente, di ba? But kung ikaw mismo ang babae, empowered ka, and you know that you will not miss the pills, you will not miss your injection, you will really follow through every day. That's a mere perfect use. So, hindi ka mabubuntis. Para na lang yan, pag ginawa mo talaga, hindi perfect yung, alam mo, yung contraception mo. Feel nyo ba na pag nag-condom lang kayo, magiging perfect use? So, marami rin siyang problem, di ba? Kasi it's a couple thing. Hindi naman ikaw lang mag-isa nagpupundong. Participant ka pa lang dyan, di ba? So, maraming, maraming issue. Ethical din. Kaya, nag-fail ang isang contraceptive method.
Okay.
Kaya siya ganun. Mabubuntis. Ako nga, sabi ko nga ganito sa ibang program pag nag-fail ang paggamit, lalo na sa COVID, di ba? Tama?
Yeah.
Pero sa family planning, pag nag-fail ka sa ginamit mo,
buhay.
Ay, buhay na baby. Walang loss.
Doktora, ano ba yung mga maybe platforms or information or offices na pwede, halimbawa, gusto nyo malaman more about family planning, may mga workshops ba yan? Or aside from asking your doctor?
Basically naman, sa FB may natalaw ako ng mga nagtatanong talaga. Tapos there are midwives or medical practitioners who are really there to answer kung ano yung mga dapat nilang gawin sa FB as Facebook. But online, I think, tanong lang kayo sa mga doctors ninyo. And po pwede naman na lahat ng mga available information ay nasa mga rural health units o nasa mga health centers. Hindi nyo na kailangan magpunta sa malalaking ospital para lang gambalain sila sa family planning na contraceptive method na gusto mo, di ba? Sa mga private lying-in clinics, ayan, trained din yung mga yan, mga private midwives. Sobrang silang knowledgeable about family planning bukod sa pagpapaanak. So, kung gusto niyo ng private, may mga doktor din, mga OB-GYN, marami yan. Huwag na po, hindi na po nyo kailangan pumunta pa sa DOH mismo to under those just for your information. Marami yan.
Okay, siguro.
At minsan yung mga,
mga barangay health centers
sa mga barangay health centers, kahit na yung mga drugstores, alam na nila yan. All you have to do lang is make it upon yourself to really be responsible and take up a contraceptive method if your intention is not to have another child or postpone your pregnancy or give birth spacing.
Ayan. Yun. Pwede naman pala.
So, hindi mo naman ganun ka.
Mga method na okay sa inyo.
So, hindi na, pwede na, kasi yung iba, sir, kailangan pag-aralan mo munang mabuti. Hindi pwedeng, hindi naman ganun ka, you can easily find an option naman no? Hindi mo kailangan mag-consult ng doctor, what goes well with your body.
Yes, available naman siya sa internet Yes. Parang pag naisip mo na, tapos meron ka nang naisip na dahil inaral mo, sinerch mo, tapos may naisip ka na, it pays pa rin consult medical doctor or midwives or your nurse na talagang knowledgeable who can give you the final advice.
Yes.
Kasi don't take it upon yourself to self-medic. Parang nagsiself-medicate ka na naman yun. I don't go for this. Wag. Kasi there are people who can best give you advice.
Baka kasi, lalo na Siguro, lalo na pag may medical condition yung babae na related sa sa
Correct.
reproductive health system.
Correct. Kasi, yes, anak ko, isang book, maraming libro yan na inaral para sa family planning method. So, wag na ikaw ang mag-decide. Sabihin mo lang lahat ng medical condition mo o nararamdaman mo, or even if you're taking a family planning method, tapos bigla na iba yung pakiramdam mo, consult.
Oo.
So Doc, marami bang nagko-consult sa'yo na hindi naman related doon sa mga family plan?
Ay, ako naman. Isa yung nagugulat ako pag nagre-lecture ako about iPhone products. Sabihin nila, nakaka-increase ba ng sexual activity ang mga products? Natatawa na lang ako. Pero I guess it's really all in the mind. But the thing is, it really helps boost your immunity. Ayan, ito yung controversial na product namin na sinasabi nila na nakaka-increase ng sexual activity.
Wow.
Hindi kami siguro...
Bakit ano ba yan? Ingredient? Natural ingredients yun eh.
At saka, natural to lahat. May zinc to and everything. Tingnan nyo na lang. But the thing is, halimbawa, sa akin, di kasi take ko nito, it really activates your body in such a way na, diba, pag ganitong oras, parang gusto mo na like me, 60 years old na ako, just ko ina-announce talaga. So, diba? And sabi mo naman kasi, don't do it. I don't really feel it din also. So it helps boost your immunity and your energy.
Energy.
So,
I need energy.
Energy. So you need that. Lalo na ito, it keeps me awake kahit na sa night, lalo na pagka marami akong ginagawa.
Okay. Siguro kailangan din yun.
Kailangan nyo yan. Kasi ito din, bukod dito, in combination with vitamin B, yung aminoperm B, ay, nawawala yung mga masasakit sa muscles ko na usually nararamdam na ng may edad. Yan siya. So it really boosts everything. Pati yung diabetes mo, meron din ako yan, na ma-manage mo because of this. Yung mga na-stroke, post-stroke, will really benefit from it. At pati itong aming milk, ayan siya.
Calcium.
Tatlong iniinom. Tawag nga namin dyan, power trio. Calcium. Ayan. It's really from the cow's milk. So, wala siyang mga bato-bato and that can cause kidney stone. So, yung tatlo lang yan, kaya ang tawag ng mga taga-hyper dyan, power trio. Milka, this one, Fern Active, at saka itong Fern din namin. Yan. Power trio yung tawag dyan. You can research it. Internet, lalabas yan lahat. Kasi talagang believe kami sa mga products namin. Natural. But the same thing sa akin, ni-research ko muna bago ko bumili. So, hindi ito blind na infatuation sa products. There's, it's really back up with researches.
Research. And you've tried it also, Doc?
Yes, we've tried it. At marami ng doctors na may caliber talaga, may decision talaga. Na nag-try din ito at na-satisfied.
Doc,
naman talaga yan.
Madami kaming natutunan sa'yo this afternoon about what kind of supplements we can take to strengthen our immunity and increase our energy, among other things. Pero what is your advice pa sa mga ating fellow Filipinos struggling to keep healthy physically and mentally in this pandemic?
Talagang really eat the right kind of food, everything, follow the protocol, mask, face shield, the controversial face shield. Tapos do away with really exposing yourself to a lot of people, and crowded places, yung mga the usual. Siyempre, huwag ka lang pumunta ng hospital kung hindi naman kailangan kasi nandun na yung nag-concentrate lahat ng COVID Tapos pupuntahan mo pa. Tapos nagulat ka pa, nahawahan ka. Tapos, try really not to be exposed dun sa mga tao na symptomatic na.
Okay.
Tapos, doon naman sa mga symptomatic, try not to expose yourself to other people. Isolate na agad. Have yourself tested. But more than that, huwag naman po kayong mag-over-protection. Kasi ganito po yun eh. Right now, pag naisip mo ang daming nagkaalat na COVID virus, na hindi naman natin nakikita kung present na siya o hindi sa supermarket or kahit sa labas ng daan. Ang tendency natin is nagtatago tayo. So, parang naglalagay tayo ng bubble sa sarili natin, right? So, ang nangyayari, hihina din yung resistance natin, immunity natin, because hindi na natin napapasok yung ibang germs. na pwede rin magbigay ng laban. Kasi kailangan practicein din natin yung immune system natin na lumaban. So pagka sobrang protected naman tayo, yun naman yung bad thing naman, disadvantage. Baka mas madali tayong tamaan. So huwag naman nating over-extreme yung protection natin. Like eat good food, kung ano man yung good food na yan, tayo lang makakapagsabi. Kasi depende yan kung anong na-afford ba yung good food na yun o hindi. But then again, ang pinaka-importante po, mental health. Keep yourself busy, less stress. Wag mo, isipin na lang mo natin, talaga, God is bigger than the pandemic. And if you really believe in something greater than the power of God, yun na lang ang kapitan natin. Kasi at the end of the day, kung kukunin naman tayo at nakadestin tayo dyan, kahit magtago tayo, makukuha tayo ni Lord ng another way, di ba? At yun ang destiny natin. So habang hindi natin nakapitan, destined ba ako mamatay para sa COVID o baka mamatay ako sa COVID? Why waste time thinking about the negative things? Ma-apektuhan ka lang yan. So, cultivate a positive attitude. Mag-busy ka, use your time wisely, and entertain yourself. If there's nothing to entertain you about it. Kasi panonood ka ng bad news, entertain mo na lang yourself mo. Just be mentally fit. Yun siya.
Nako, ang daming mga advice na very practical at the same time very helpful sa atin. Tama.
And don't forget your sex life, of course.
If we have it. Bakit?
So, try to cultivate a healthier life by having a healthier everything.
Yes.
Sabi nga nila, happier life with your partner. One and only partner. Sige, ho.
Yes. So, isipin na lang po natin, buti nga po hindi tayo yung most of our generation ay hindi nabuhay nung World War something, di ba? At wala pang nagbabat pa ng World War something. This is a pandemic, but relatively, we can do the best of it. Hindi tayo nagtatago sa mga bayoneta o tutupan o
That's right.
Nagtatago lang tayo sa invisible natin na kalaban, COVID-19 virus. Kaya natin because God is bigger than the pandemic.
Wow, thank you so much, Doc. I think, pwede na tayong off to bed. After this conversation. So thank you very much for sharing your knowledge and advice and
about
insights.
life, medicine, everything practical, even faith, tinakil din ni Doktor.
Pati faith, it's nice to hear it from a doctor, somebody who's right there, di ba, fighting COVID for everybody.
Yes.
So, thank you very fighting COVID, fighting unwanted pregnancy.
Just what we can contribute in our own small or big way. But the thing is, reach out. Yun lang tayo. Just have to reach out. Hindi naman tayo pwede magtago lang beside the dead tree. Just have to reach out in our own small way.
Ganda.
And thank you also for both of you for giving me this opportunity. And in behalf of the iPar Nation and our CEO and President, banggitin ko na, Pamanitan, Sir Pamanitan, ayan. And the whole of the iPar Nation. Kahit business to, my God, it has brought so much joy and health and wellness to the lives of so many who are members of iPar. And thank you to all.
Business opportunity din.
Yeah, and that's it for today. So we've been given an idea, to what to do during this pandemic. You can also get into this business, or you can just get the products for your own health. Diba?
So and try to have a good sex life.
Yes, you can always approach any one of us.
Okay, okay, so Francine,
try to have a good sex life.
Keep yourself well.
Good sex life.
Thank you very much, Doc. Anabelle Fajardo. This has been Dina Ventura.
And this has been Francine Marquez. And this has been
PairFect.